Okay, thank you. We appreciate your testimony. Ms. Saxton.
Hi, good afternoon, Committee. Chair, thank you for the opportunity. My name is Josette Saxton with Texans Care for Children. We are a nonprofit, nonpartisan children's advocacy organization that works to promote state policies to improve children's well-being across various issue areas. I cover mental health issues for our organization, and I'm here today to ask, as you are looking at strategies on how we can improve student outcomes, how we can better prepare students for the career after school, for job preparation, that social emotional wellness and mental health needs to be part of the conversation. Research confirms what we intuitively know, that if a child is depressed, if they're stressed, they're anxious, if they have a mental health diagnosis, if they're unable to form positive, healthy relationships with peers, they are not going to be able to focus on their schoolwork to the degree that we need them to be. We know that students' mental health is linked to their academic performance. We know that student mental health is linked to dropout rates, and we know that mental health is linked to discipline issues. So what I'm asking you to do is, we already have some structures within TEA, within our budget, on how we can help schools support students' mental health, their social emotional development. And I've highlighted some of those areas in my written comments. Coordinated school health is a wonderful infrastructure that we already have in place in schools, that schools are using to address issues such as obesity and health issues. And they are, I think, jumping at the bit, schools, and some of them are already doing it, on using this CDC recommended strategy to also address students' social emotional wellness and their mental health. It helps schools maximize the resources that they have, both internally and in the community, to make sure that kids have that basic health and well-being foundation to be able to have those academic successes that we're looking for them to. Training and technical assistance to the districts, and we heard about that too from the Commission as a priority. Yes, we need to do more to empower students and not only address some of the academic issues, but also giving them the strategies and the tools on how to recognize, respond, and know how to refer out when there are mental health concerns. And finally, communities and schools. Very happy to see that the LBB is coming out with a recommendation for increased funding. It's another powerful way we can help communities, help schools address students' mental health and for the school outcomes that we're looking for. Thank you.
Thank you.
Hi, everyone. My name is Lauren Dimitri, and I'm from Texans Care for Children also, and I want to thank you for the opportunity to offer comments today. I work as our health policy associate, so I work on all issues related to children's health in the state of Texas. And today I really wanted to specifically offer comments on the health and safety item of TEA's budget. So in order to promote success and the well-being of Texas students, the legislature has traditionally funded TEA to establish and maintain a school health infrastructure. And you heard earlier, you all have asked that schools do that with a coordinated health school model. And that's in order to ensure that that's streamlined and that those are efficient, that's being efficiently implemented. As it stands now, however, Senate Bill 1 would continue to erode funding for much of this health infrastructure. The proposal, as we're reading it, is a 6% cut from what was appropriated last biennium to the health and safety item. But I think the thing that's really important to note here, and this is all in written testimony, so I won't go over it, but this is actually on top of a really large cut from last session. So that the 6% cut would bring it basically to a 74% reduction in funds from 2010. And this is really devastating to our school health infrastructure. And I thought really I would just use my time today to sort of just tell you guys a little bit about the sort of ripple effect that has. After last session, we went back to our partners across the state, schools, everyone that we work with, researchers, and we really said we need revenue neutral, practical solutions to school health. The state we have funding issues, our schools are really struggling. And so we did that, and we came up with some policy priorities, and the catch really is that many of those policy priorities utilize the existing school health network. So if we continue to erode that school health network, we're really tying the hands of everyone that's trying to move forward at a time when we know we have limited resources. So Texans Care for Children just really urges you to reconsider the health and safety funding that's going to our schools, and I'd welcome any questions that you have regarding that. Thank you.